Good morning, guys. It is July 17th and it is 8:26 in the morning. I tried to sleep in as long as I could because it's surgery day. Surgery number 4 of this medical plan, and I'm not ready at all. Literally and mentally. I have to clean, my nightstand's a mess of waters. I have to wash my bed or change my bedding. I need to shower, and I have to be there at 11:30 in 3 hours. But that's how I wanted it. I wanted to sleep in so that way I wouldn't give myself time to think because I'll just be rushing around doing things. So let's get ready. Okay, it is 8:45. It still looks like a mess, but I have wet wipes, Kleenex, ponytail, chapstick, all the things, a little snack that I might need on my nightstand.
Get out of there.
I have a trash bag over by there. I'm putting my water cup in the kitchen because I don't need this. And I'm gonna keep picking up for a little bit. I want to clear off this table and then I need to shower. Okay, it is 9:20 now. I have showered and the room's a little more picked up. I'm losing my voice. What? Why are you being crazy? I'm supposed to stop drinking water 2 hours before surgery, but I also have to be able to pee in a cup when I get there. So it is 9:20, and I'm gonna chug a water bottle so that way, hopefully, I have to pee by the time I get there. Okay, my dudes, it is 10:37. I have literally been laying on the couch watching YouTube videos this whole time, but we are gonna leave in like 15-20 minutes. So I will show you what I'm bringing with me. I literally just make sure I have my ID, my insurance card, and my phone charger in case I get admitted. And my phone, of course. I bring my whole purse, but those are the essentials. Also, I am so hungry. It is 10:40 and I haven't been able to eat anything. And I won't be able to eat until like, I don't know, probably like 3 or 4. That sucks. I'm starving. Okay, my dudes, it's 10:51. Quick surgery fit check. Hold on. My hands are kind of full. We got a shirt, no bra, athletic shorts, hey dudes, my purse, a water bottle for after. I'm not drinking it right now. I'm not allowed to drink anything. But I'm bringing the rest of my water bottle from this morning to leave in the car for after surgery on the way home because sometimes I get nauseous and sipping water helps. And then I have my phone charger, I have my glasses. I'm not going to be able to wear them after surgery, but I can wear them on the way there and like navigating the hospital. And we have my driver because I'm not allowed to drive. We're here. It's 11:29. We're here. I need to pee so bad. I've had to pee since like 10:30, but I knew I was gonna have to pee once I got here, so I didn't want to go. It's 11:40. We checked in at the first desk. Now we're waiting to be brought in to the real check-in. And Shane lied.
No, okay. When closing your head up entails like they're done drilling the hole or whatever, or they're like wrapping up. Like
That means they're stitching me back up. There's a screen out here that this is where Shane waits for me, and there's a screen that like has what
it
stage
always
of
skips
surgery
from
I'm
green to
in.
purple for me. Because your
Maybe
head
it's 'cause you
procedures
just
are
don't pay
closed
attention.
up pretty fast. Or Herzog forgets to push the button.
I don't think Herzog is in charge of updating this. There's like 20 people in the room. Anyways, we're checking in. I couldn't vlog in here because there were a lot of people, but I was getting all checked in at this point, and then we just waited in the waiting room until I was called back. It's 12:30. I finally got brought back. I have to pee in a cup. They got my weight and height. So after I pee in the cup for the pregnancy test, they bring me to my room and I get dressed in my little outfit. They don't let anyone come back with you guest-wise until after you have your IV and stuff, just because they don't want a second patient from someone passing out. So I was just chilling for a while, waiting on the nurse to come in and start all of that stuff. Not pregnant. Officially can have the surgery. It's 1 o'clock. I'm under a warm blanket because it's cold. They did my IV. I'm talking quietly because there's people out there. Shane's laughing at me.
I'm laughing at you.
They had to poke me twice. So that sucked, but it was better than like 6 times, like the one surgery. And my nurse is really nice, so that's cool. Yeah, my lips are so chapped, I can't put chapstick on. Got my vitals up there to show I'm not dead. I'm also cold. Thank you. I'm not being dramatic. Shane's also shivering. I'm just under a giant warm blanket. Anyways, they're gonna bring me back in like 20 minutes, so this will probably be my last clip. I'll see you after surgery. Shane's judging me. Hi guys, this is me 6 days post-op now, and I'm editing this surgery vlog, and I wanted to give you guys a little bit of a heads up. That was my last pre-surgery clip. The next clip is right after surgery when I woke up. I don't remember recording anything, so I just want to give you a heads up. I am very groggy. You can tell I'm drugged. You can tell I'm loopy. My hair is super sweaty and bloody, but you can't really tell what's sweat and what's blood. So just, I look rough in this next clip. I don't want to like scare anyone with like the sharp contrast from the last clip to this clip. So I'm inserting this just to give a little warning. Obviously I'm gonna look rough after surgery, and yeah, so 6 days post-op, spoiler alert, doing good now. But this is surgery side. But yeah, let's watch the rest of this video. I just wanted to give you guys a heads up because it's intense. It's 3:31. Out of surgery. Shane's judging me.
I'm not judging you. You always think I'm judging you.
Hard. I'm waking up. I'm so really groggy. And I probably won't remember any of this. I forgot to say I had applesauce and water and a pain pill. 4:00, we're heading home. I hurt, but they gave me a pain pill before I left. I'm also really sweaty, so I just feel gross. It's 4:30. I made it home. I put on my hair and a bun on the top of my head because it's all bloody and gross. I had Shane pull off my socks because they hurt.
I see that, a big orange one.
I don't want to show you my toes, but like, look at that. That's from the socks. And then my legs have marks from they put on these like compression things on my calves for like blood clots or some shit, I don't know. My throat hurts because of being intubated. That's always the worst part after surgery, is my throat just hurts. And I feel like I don't have my voice and stuff, but it's really no worse than like if you've had strep. It's honestly, it's not even that bad. It's just like a scratchy sore throat. Like you can tell a tube's been in your throat, basically. I still have all this on my arm because I bleed a lot. And so when they fail IVs, they have to put like the compression band on. Normally this is a little bit further forward, but because of this kind of surgery, I just touched that patch I shouldn't have. This surgery, the incision's a little further back, so I think that's why there's a gap. Shane's
Nicole got a Stanley.
I know, she sent me Snapchats. I'm updating the vlog on everything.
Nice. We're gonna, I'm gonna go pick up your prescription because Nicole needs to go pick up her meds too, so she'll just ride along and we'll stop at Walgreens as well. So anything you'd like while we're out?
Just weird ass looks. You're comfy.
Sweatpants and sweatshirt.
It's actually not all that fucking hot after the storm, so
True.
it's toasty, but still. Alright, we're back in a bit. Are you gonna be good? We'll be good. We'll be like a half hour tops.
As you heard, Shane and Nicole are going to get my medicine because it has to be picked up from the pharmacy. Anyways, what I was trying to show you, things I didn't get to show you in the hospital because it was just chaotic, but behind this ear, which is my not surgery ear, hopefully you can see there's a little round patch, and that is essential for surgery. If they don't give you a nausea patch or don't want to give you a nausea patch because you like don't have experience with having nausea after surgery, ask for it. Tell them you want it. Because I had one surgery that they didn't give it to me. I was like 13 maybe. And you just don't want to risk nausea after the surgery because my stitches are like from here down and back, like the whole size of this basically. Hopefully there's no blood over there, sorry. And if you're nauseous and throwing up after surgery, you're gonna rip open your stitches. That happened to me, and I had to be hospitalized overnight when I was like 13. So ask for the patch. You're not allowed to touch the patch because I don't know what it's made out of, but like it'll dilate your eyes and stuff. So don't touch it with your hands. And you can leave it on for like 24 hours after surgery. So it works for that long. And then you just take it off with like toilet paper. And then on this side, you can see this bandage takes up like the whole side of my head. The pen marks, oh, you can't really see it because it's under there. But the surgeon always marks the side that he's operating on with like a marker. I'm sure I'll think of other things that I should be telling you. But right now I'm so loopy on drugs. I'm not in pain, aside from my throat being scratchy. I mean, I feel the incision, but it doesn't hurt. And as long as you stay on top of pain meds, normally it's okay. But I'm gonna keep vlogging at least the next few days to kind of give you an idea of what the initial recovery process is like. Tomorrow I'll take off my bandage and I plan to share everything. So if you're having the surgery or if you're considering having the surgery, sorry, I forgot that my hand there would mess up the camera. I just want to give like a full, honest vlog of the surgery so that way this resource is out there for people because I never had anything like that. I went in blind. Anyways, I'm gonna rest and stop talking because my throat hurts. I'll update you at some point. I'm starving. They gave me an applesauce at the surgery center because they wanted me to eat something. But that's all I've eaten today and it's 4:40. So I'm starving. I apologize in advance because there's going to be a lot of footage from like right here. I just wanted to say, so it's 5:20 now. Something I realized that I forgot to mention is how gross you feel after surgery, right? Obviously I'm covered in, like, my hair's all bloody and like the obvious grossness. I'm losing my voice pretty bad. But also from being intubated, your mouth tastes and feels really gross. Your lips feel gross. You're really chapped. I don't really know how to explain it. It's not painful. It's just uncomfortable. You feel gross. So something I always have on my nightstand of stuff is wet wipes. I just have water wipes. So I'm gonna go ahead and just wipe my face off with this. You don't want to get anywhere near your incision or anything right away, but just to like get the layer of grime off of my face. Also, the first thing I did when I got home is went and brushed my teeth. I went to the bathroom and I brushed my teeth because yeah, that's something else that like your mouth feels gross. Food tastes really bad for the first couple of days. I don't know what it is about being intubated, but like it just leaves this lingering gross feeling in your mouth. Also, I would say it's hard to eat, it's hard to chew at first because moving your jaw hurts the stitches, but anything that you can eat that's like a little bit more flavorful is easier to eat because you don't taste the tube as much. I don't know if that makes sense. It makes sense if you're going through it. So, yeah, keep that in mind. Like, one of the things that I really want right now is like orange chicken, which I know is going to be hard to chew, but the sauce on the orange chicken is going to be enough, I think, to overpower the taste in my mouth, which is helpful. There was something else I was going to say, but I don't remember. If I remember, I will let you know. Drinking water is also hard because of that taste, but you need to drink water. Yeah, just a little piece of advice, piece of knowledge. Your mouth's gonna taste gross. It is 7:30. My mom just left. She hung out with me for a little bit, and Nicole just got back with some food. Thanks, broski. She brought me some orange chicken. Hopefully I'm at least gonna be able to eat the chow mein. And then I'm gonna try to eat a few pieces of chicken too. Crap, I locked that. You got it? Whoops. Chewing and swallowing is really hard after surgery because every bite and like every time you bear down, I can feel the stitches and it does not feel good. It doesn't hurt, but it feels wrong. Like you can tell that your skull's not connected or your skin's not connected. Shane just got me another water. Stay hydrated. And now he's messing with the cat. I'm gonna try to eat some of this and then I just dropped it. My hands aren't working. And then I have to stay up until at least 9 because at between 9 and 9:30 I can take a pain med and I can take an antibiotic, but I need to get some food in my belly before I take an antibiotic or I'm gonna get nauseous. And we can't do that. No puking. So I'm gonna try. This flash is really bright. It's 9:50. I forgot to update the vlog. I ate some of my food and I also had a yogurt because I'm on antibiotics, so it's important to drink yogurt. Huh?
You have yogurt?
What?
You have yogurt?
I got myself some Chobani yogurt drinks.
Nice.
Not like normal yogurt, unless there's still some in there. Anyways, so I got a little bit of food in my belly, and then at 9:30, so like 20 minutes ago, I took my antibiotic and a pain pill. They gave me a hydro Tylenol combo and then a amoxicillin, so I took both of those. I'm hoping my stomach doesn't get upset because they're strong drugs, but so far so good. And I was just starting to feel the pain in my ear pretty bad, but then I took the pain meds, so I'll be good for a couple hours. And I'm gonna try to fall asleep because that's my best option, is to fall asleep now while the pain's minimal. I don't know why that's starting to bleed through. I think I'm gonna try to shove a piece of gauze in this front part, so that way if it does bleed through, it doesn't get everywhere. I wonder if there's any blood on the white, like if it's bleeding through this part yet. I'll have to watch this video back to see, but anyways, I'm gonna fix that because that's bleeding through. Yay. It's fine though, it always bleeds through a little bit on the first night. Day 6 of recovery, me again, and I wanted to hop on to say this is the end of this video, but I also vlogged my first 3 days of recovery and we'll have that video up within a day or two. So watch this one and then go watch that one to see what the full recovery thing is like. I guess not the full recovery. I'm only day 6 and I stopped vlogging after day 3, but we're doing okay-ish now.